Yes, yes, I could possibly stand here today and say, yeah, that dentures were, okay, they've got dentures, that's fine, they haven't got any teeth, you know. Maybe just pull them out, give them a quick brush, put them back in.
Yeah, when I first started, I didn't realise that dentures needed so much, well, similar care, the same amount of care that you with your real teeth.
It's important, even if the person doesn't have any natural teeth remaining in the mouth, that they have an oral health care plan and they get their mouth checked by an oral health care professional at least once every 2 years. If you're using dentures, as we can see here, it's very important that in the oral health care plan that the care of the mouth and the dentures is documented and followed as a routine. Make that part of your routine, so you do it on a daily basis and the resident is used to it. Routinely at night, the denture to be removed, cleaned, both sides, the fitting side which fits onto the gum and the chewing side which is the outside, and then put onto a glass of water overnight. Make that part of the routine so the resident gets used to it and it's part of your routine as well. When you're doing the cleaning, it's important to do it over a towel or a bucket of water, so if it drops into the basin, it doesn't shatter or break. You don't need any specific, toothbrushes or anything because they can be quite harsh. Just a normal soft toothbrush with a small head. Again, don't use toothpaste because they're too abrasive and they can scratch the denture, which will make more bacteria and food particle, impregnate into the denture, causing more infections. So just mild detergent and a bit of water. Just wet the denture, put a little bit of detergent, and just use the toothbrush with mild, movement, small movement. Make sure you remove any food particle, clean it, rinse it, and leave it in a glass of water until it's ready for use the next morning.
If possible, rinse dentures under running water after meals. If dentures do not fit properly or are chipped or broken, it's important to consult an oral health professional. Some oral hygiene products, such as mouthwash, should only be used if recommended by an oral health professional. There are a range of products listed in the Residential Services Practice Manual, Section 5.10, Oral Health.